The diseases of respiratory tract are classified into two types: restrictive respiratory disease and obstructive respiratory disease. Our question of the day is, what is obstructive lung disease? Obstructive. Name is suggesting that there's some kind of obstruction. Yes. These diseases are characterized by an obstruction in the airways. Before getting into its detail, I would like you to revise some important concepts here that would help you better comprehend this. Well, you must know that what happens during inspiration is that the diaphragm and intercostal muscles contract. Ribs are pulled upward and outwards. The chest cavity expands, hence reducing the pressure. As a result, air rushes in to equalize pressure. The ability of lungs to stretch is known as compliance. This air enters the alveoli, where gaseous exchange occurs. During expiration, intercostal muscles and diaphragm relax. Pull the ribs downward and inwards, reducing the size of the thoracic cavity, and hence air is pushed out of the lungs. This tendency of lungs to deflate following inflation is known as the elastic recoil of lungs. Now, to measure lung function, we use different lung volumes. Here is the amount of air you inhale and exhale during quiet breathing. It is known as tidal volume, while the amount of air inhaled during forced inspiration after the normal inspiration is inspiratory reserve volume, and the amount of air exhaled during forced expiration after the normal expiration is expiratory reserve volume, while the amount of air left even after maximum expiration is the residual volume. Total sum of all these four lung volumes is called total lung capacity. The amount of air that can be inhaled and exhaled with the deepest possible breath is the vital capacity. Next up is the inspiratory capacity. That is in fact the maximum volume of air that can be inspired after reaching the end of a normal, quiet expiration. Now, the functional residual capacity, or FRC, is the volume of the lungs at the end of a normal breath, when the respiratory muscles are relaxed. The volume of air which can be expired forcefully in 1 second after a deep inspiration is called forced expiratory volume 1, or FEV1. Lastly, the volume of air that can be exhaled forcefully and rapidly after a maximal or deep inspiration is called the forced vital capacity, or FVC. Now, let's get back to the obstructive lung disease. Well, in order to reach the alveoli, air must pass through the respiratory tract, or airways, which present a resistance to the flow. And this resistance is determined by the lumen in the tract. Narrower the lumen is, greater will be the resistance to the airflow. Now, this increased resistance can be caused by processes that occur within the lumen, in the airway wall, or in the supporting structures surrounding the airway. Well, the examples of luminal obstruction include the increased secretions seen in asthma and chronic bronchitis. Airway wall thickening and airway narrowing can result from the inflammation seen in both asthma and chronic bronchitis, or from the bronchial smooth muscle contraction in asthma. What happens in asthma is that there is an allergy to inhaled antigens, which cause an inflammation of the bronchial mucosa. leading to the release of histamine and leukotrienes, called slow-reacting substances in anaphylaxis, or SRSA. The bronchial muscles contract, and mucus secretion, as well as vessel permeability, are increased under the influence of these mediators. This one is known as mucosal edema. In addition to the inhaled antigens, microorganisms in the mucosa may also act as antigens, resulting in what we call infectious or allergic asthma. While classic example of obstruction caused by loss of surrounding supporting structure includes emphysema, which is an expiratory airway collapse, resulting from the destruction of lung elastic tissue. There's no scarring in obstructive lung diseases, so it is easy to stretch, and higher is the compliance. Easy to stretch means lower will be the recoil. Note here that it's quite opposite to the restrictive lung disease, where we find a low compliance, but a higher recoil. I mentioned in the very start of the video that elastic recoil makes the air move out, helping in expiration. So, a decrease in elastic recoil affects the expiration, while there is no significant change in inspiration. Again, opposite to the restrictive lung diseases, where a decreased compliance affects mainly inspiration. So, in obstructive lung disease, as the lungs do not recoil much, they are not able to expire much air. This results in an increase in the trapped air in the lungs. So, in obstructive lung diseases, we observe that there's an increase in residual volume, functional residual capacity, or FRC, and total lung capacity, while there's a marked decrease in forced expiratory volume during 1 second, or FEV1. Also, there's a decrease in forced vital capacity. But the ratio FEV1 to FVC is decreased. This is because FEV1 decreases more than FVC. Well, this ratio is very important in diagnosis of restrictive and obstructive lung disease, as it increases or remains normal in restrictive lung disease and decreases in obstructive lung disease. Now, there is a plot of inspiratory and expiratory flow on the y-axis against volume on the x-axis. This is called a flow-volume loop. This is how the flow-volume loop of a normal individual looks like. Here is the residual volume, the vital capacity, and the total lung capacity. Now, compare this with that of a patient with obstructive lung disease. You can see that the loop shifts to the left, as this was the normal flow-volume loop. Also, note the large increase in the residual volume, which is the amount of air left after the maximum expiration, as there's a decrease in the amount of air expired. So we have more amount of air left in the lungs and increased residual volume. Well, this is because the volumes are increased in obstructive disease. So, that brings us to the end of this quick video. For more such precise videos, keep following sqadia.com.
Explore our extensive library of over 1,800 video lectures to learn about a wide range of topics. Only on sqadia.com.